Children are more likely to get swine flu than any other age group, but new research shows the medicines promoted by the government to treat it just aren't worth the risk. Public health experts found that antiviral treatments do nothing to prevent the most serious complications of the disease in children, and Tamiflu, the drug prescribed to most patients, has side effects that make it unsuitable for treating such a mild form of flu. For parents, the research adds to the confusion over what to do if their children get the virus.
There's never enough information out there for parents for flu, coughs, colds, anything, because everything's changing nowadays.
Well, I know there's might be some side effects, but you have to weigh the pros and cons. If it's going to make her feel better quicker, why not?
I did think one of mine had swine flu, so I phoned the doctor, because that's what our surgery tells you to do, and they diagnosed it over the phone as swine flu, but the doctor said that there would be no need to give any antivirals.
The research published in the British Medical Journal shows that antiviral drugs reduce the length of the illness by around 1 day. However, there's no evidence that the drugs help to reduce asthma flare-ups or cut the need for antibiotics for secondary lung or ear infections. And while Relenza is well tolerated, 1 in 20 children taking Tamiflu suffered from vomiting, which can quickly lead to dehydration. The researchers say most children are better off with bed rest and paracetamol.
It's important to recognise with antivirals that they don't actually reduce the complications of the disease. So when you've got a child with mild illness, what you would normally do is conservative measures. You're trying to keep the fever down, so some people might use antipyretics, such as the Calpol. Some people might use wet sponging, and you keep an eye on your child.
This mother says she no longer trusts the government to tell the truth on medicines. She gave her 6-year-old Tamiflu last month and now regrets it. She won't give him the vaccine when it becomes available this autumn.
I don't know what to think anymore. These things seem to be ineffective. Are they using us as guinea pigs, or is it just the blind leading the blind? I don't know what's happening anymore. I'm confused. I am confused.